Over the years, technology has advanced from large stationary devices to the tiniest portable and wearable devices. Usage of these devices now varies from entertainment to education and also medical treatments. In this presentation, we will discuss wearable technology in the form of spinal cord stimulators and digital glucose monitoring therapies. The research team consists of Shavius Alford, Renee Epps, Brittany Henry, and Ebony Lucas. Our goal for this project was to analyze the efficacy of two wearable devices within the healthcare field. After a brief introduction, we will discuss wearable technology and how it is used. The definition of emerging technology will be followed by an examination of spinal cord stimulators, glucose monitoring devices, and clinical trial results for each. The presentation will conclude with an insight into the future of wearables and a brief recap of our research findings. Wearable technology is advancing at an unimaginable rate. Since it covers such broad categories, it will be impossible to completely cover each advancement in one setting. Today we will focus on the improvements that have been made in the areas of pain therapy and diabetes. What exactly is wearable technology? This term describes any device that can be worn by a consumer. The first types that come to your mind are probably those that are related to health and fitness. Other common gadgets include smart jewelry, cameras, and various types of body sensors that can be paired with computers and mobile devices. In what seems like the very distant past, this type of technology was seen as only lofty ideas in a pure research stage. Thanks to the tech progress made to date, there has been a major shift to practical applications of wearables. The most important developments that have been made are those in health-related domains, health monitoring specifically. Smartphones, smartwatches, and pretty much all technology that is considered smart have heart rate monitors, body temp sensors, and even oxygen saturation indicators. What people don't realize is the same technology that helps you with your daily workouts helps many others manage their serious health conditions. Devices like stimulators help people deal with pain. Devices like glucose monitors help replicate normal body functions. Both types give their wearers a chance at a better quality of life and in some cases improve their medical diagnosis. Improved health translates to a decreased need for medical interventions. These technologies, now more commonplace, even have the ability to help one of the biggest issues facing our country, healthcare costs. Chronic pain is experienced by a great number, affecting 1 in 5 adults across the globe. It can be so debilitating that the burden of everyday life is too much for people to bear. Chronic pain is often a secondary disease which emerged as a distinct phenomenon within itself. One major treatment utilized is spinal cord stimulation. It is a practice that has been in use for more than 40 years and was designed to block or change pain signals from the back, arms, and legs before they reach the brain and register as pain. As technology has advanced, so has this neurological stimulation therapy with the development of burst DR stimulation and dorsal root ganglion therapy. Burst DR stimulation is meant for individuals who experience chronic pain in broad areas of their back, arms, or legs. It works by mimicking natural brain patterns. Pain reduction comes by altering the pain signals as they travel to the brain. The system works by using the following steps. First, pain signals travel up the spinal cord to the brain. Second, a generator that is implanted within the body sends pulses along a lead. The lead sends pulses to specified nerves along the spinal cord to modify the pain signals as they travel to the different parts of the brain. In turn, the pulses change the way the body perceives pain, providing relief to those who suffer with chronic pain. The system is designed to give wearers more control over their pain management. The relief provided by the Burst DR system not only helps improve the physical condition, but helps with the emotional toll that pain places on the body. Dorsal root ganglion therapy is the second type of spinal cord stimulation covered in our research. It was initially used to treat chronic pain in the hip, knee, or foot. Studies conducted have shown that 7 out of 10 patients reported more than 80% pain relief when using dorsal root ganglion therapy. The dorsal root ganglia are structures along the side of the spinal column that are made up of closely populated sensory nerves. These nerves regulate signals and sensations traveling through nerve fibers to the brain. Each nerve root communicates with the ganglion sensory messages to define areas of the body, which makes this treatment the most suited for targeted pain relief. Dorsal root ganglion therapy works similar to Burst DR. An implanted generator sends pulses through leads with electrodes that are near the dorsal root ganglion. Patients are given a controller that works on Bluetooth wireless technology to switch between stimulation settings. Two great features of this system are that there is no battery charging needed, and the devices that patients use to control their stimulations are equipped with upgradable software. Spinal cord stimulators have the potential to improve lives as researchers continue to study the effects of pain in the body. No two people will experience pain the same, so like most medical interventions, spinal cord stimulation will not work for everyone. Individuals now have the opportunity to receive a trial system to determine the effectiveness of a stimulator on their individualized pain. A temporary spinal cord stimulator lead is inserted for up to a week for patients to experience what type of relief could be possible with a permanent device. If a patient experiences a significant reduction in pain or a lessened need for pain medication, the trial is considered a success and the patient becomes a candidate for a permanent device. MRIs are an important tool physicians use for diagnosing and treatment. In previous models of spinal cord stimulation systems, patients were unable to have MRIs because of the possibility that the wires and electrodes could raise in temperature and cause harm to the spinal cord and other surrounding structures. There is also danger of the device moving inside of the body during an MRI due to the strong magnetic fields. With the advancements in spinal cord stimulation technology, there have now been models created to allow people to have MRI scans done safely and effectively. Newer models can even be turned off for surgery procedures so that there is a minimized risk for damage. In 2015, a study was conducted using the Axiom dorsal root ganglion spinal cord stimulation system. A sample population from both European and Australian nations was selected of individuals over 18 years old. Patients were chosen who had been diagnosed with chronic neuropathic pain noted in the trunk, sacrum, or lower limbs. A standard was established by conducting a 30-day assessment with temporary devices where the permanent transmitter would later be implanted. To determine the overall effectiveness of the transmitter, subjects were asked to give feedback in respects to pain in the areas of the back, legs, and feet, using the standard 100 millimeter visual analog scale, as well as the brief pain inventory. At the end of the study, researchers were encouraged by the results. Patients reported an overall reduction in pain experienced by 56%. Along with these findings, localized pain was reported to have been reduced by 42% in the back, 62% in the legs, and 80% in the feet. The success of the system in this trial shows how effective spinal cord stimulation can be. With continued research and advancements, these numbers will only continue to grow. Diabetes has become a leading cause of death worldwide. It is characterized by the body's inability to produce insulin, which is type 1 diabetes, or the body's resistance to insulin, which is type 2 diabetes. Diabetics must keep a watchful eye on their blood glucose levels at all times. Food, medication, exercise, and stress are all contributing factors. There is currently no cure, but with medication and accurate blood glucose monitoring, complications from the condition can be alleviated. Recent advances in technology, particularly the development of digital blood glucose machines, have significantly decreased the amount of blood needed for glucose testing and have become the typical practice of patients in self-managing their condition. What was once a clinical procedure developed into machines for in-home use to now having access to portable, discreet, and convenient testing at any time and place deemed necessary. Individuals have the ability to incorporate the use of their smartphones to take their blood glucose levels, store the information, and provide that information to their physicians. Our research led us to two devices that are making big changes in the way diabetes is managed. The first is the Dario all-in-one smart glucose meter. It is compact enough to fit in your pocket and contains disposable test strips as well as a lancing device. There is an added convenience in the fact that the meter does not have to be charged. It obtains its power directly from the user's smartphone. Once a strip is inserted, results are displayed in 6 seconds and records can be managed through a smartphone or by use of the Dario web portal. The Dario meter also meets international organizational standards. The second glucose meter making an impact on today's diabetic community is the iHealth Smart Wireless Glucose Monitoring System. This meter connects through Bluetooth technology to either an Apple or Android device, delivering blood glucose levels for storage in much the same way as the Dario meter. It is portable, but it must be charged. The system includes the monitor itself, a lancing device, a charging cable, and a carrying case. Digital blood glucose meters have the potential to improve lives by allowing for further integration with the technology individuals use daily. By combining blood glucose devices and smartphones, the likelihood that the recorded information makes it to the user's physician is increased. The physician is able to get an accurate picture of their patient's daily health, which in turn assists the physician in prescribing a treatment plan based on previously recorded data and not just what the patient is presenting at one moment in time. In 2017, a study was conducted to explore the effect of the GlucoTrack device on blood glucose management. It is a non-invasive system with a sensor that clips to your ear and provides blood level info to the wearer through a handheld digital device. It works by measuring the physiological changes of glucose in the earlobe tissue using ultrasonic, electromagnetic, and thermal energies. 242 patients with type 1 and type 2 diabetes were chosen with varying characteristics of age, gender, body mass, and whether or not they have an ear piercing. Age was used as a variable because tissue structure and hydration changed with age. Gender was used as a variable because men's skin is generally thicker than women's. Body mass was used as a variable because it affects the amount of metabolic heat generated. Ear piercing produces scar tissue high in collagen and could change tissue Contents. A truly successful monitoring device must be accurate across a wide range of demographic profiles. The results of the study found that non-invasive blood glucose monitoring shows great promise in providing accurate blood glucose levels. No difference was found between males and females over all age groups or between individuals of different body mass. Having a pierced ear also had no effect on glucose readings. The GlucoTrack would be a great option for anyone with a recommendation from their physician for non-invasive glucose monitoring. Both spinal cord stimulators and digital blood glucose monitors are exciting technologies because of the innovations and advances in their respective grounds. Wearable technology allows patients to experience life-altering methods of maintaining their conditions. Physicians will have greater access to their daily health records and can treat them more proactively. While no one knows the exact reaches wearable technology will attain in the future, we do know that the field will continue to improve. The following video provides a brief look at where wearable technology has been and where it could be headed in the future.
Right now in 2015, there are approximately 7.2 billion people on our planet, and most people at some point encounter a health-related hiccup during their life. Thankfully, with the ever-evolving health technology sector, we're all in better stead for prevention and recovery than ever before. For instance, in this exact moment, there are 19 million people keeping track of their fitness using wearable tech. Surgeons have access to the eye knife that can actually smell cancerous tissue. And thanks to stem cell therapy repairing damaged heart tissue, people are getting back on their feet. And it doesn't stop here. The year 2020. Population 8.1 billion. And the demand for wearable tech has risen up to approximately 60 million users in the world. It's even integrated into our daily chores. Yes, that's a smart trolley. Helps keep us fit and you want to go further? The year 2050. Population 9.6 billion. A place where the tech we use and our bodies are one and the same. Sensor-clad garments are keeping every bodily movement analyzed. Robots are assisting in surgeries, and your prescription and treatments all start with a look at your DNA. There's hover wheelchairs, laser injections, Wi-Fi charged pacemakers. It's all available to us. It's on its way. As the evolution of health technology carries on taking us to a place where the imaginable is possible.
As the future of wearable technology aims toward becoming the standard, healthcare providers will continue to build upon these advances, leading to better care for all patients. We thank you for your time and hope you have enjoyed our presentation.